Good evening, everyone. Welcome to our first episode of PAHCOM Live. So exciting. We've had this idea for a while now, how we, as your National Advisory Board, could bring back that spirit of connectedness that those of us who were fortunate enough to go to conference had as we would talk in the hallways about important topics. So this is the closest we could get in a virtual format. This is less webinar and more conversation between PAHCOM managers. We are not attorneys. This is not legal advice. This is PAHCOM Live, where we get to share information and knowledge with one another and have a good time doing it, albeit in a much smaller format, maybe 45 minutes, okay? With me today are Crystal Bruning. Hi, Crystal, she's CMM. And Kim Krause, CMM, and the three of us are your National Advisory Board. Crystal, would you like to introduce yourself?
Oh, okay, I can. I'm Crystal Bruning. I'm from Orlando, Florida. I manage an OBGYN practice, and I've been CMM for about 8 years now, and this is my second year on the NAB.
Perfect. Yep. Kim, tell us a bit about yourself.
Hello, I'm Kim Krause. I've been a PAHCOM member since 2004, happily. CMM for about 8 years also. I've been on the NAB for 5 years now, and boy, it's been a great experience, just trying to help members connect and meet their needs and just kind of be a liaison there, and I just love it. And so I'm really excited about this new format that we're doing.
Me too. And if I didn't introduce myself, forgive me. My name is Coley Bennett, and I am the chairman of the NAB. And I can tell you that this is going to be super exciting for PAHCOM. Getting to speak to our managers one-on-one, to talk about hot topics from the listserv is such a great idea. And thank you so much to National Office and our incomparable Karen Blanchett for giving us such a great tool to connect with the membership. If you have any ideas for a future PAHCOM Live or something you want to talk about, please do reach out to us at nab@pahcom.com. That's N as in Nancy, A as in Apple, B as in boy, at pahcom.com. All right, ladies, let's reduce our cameras and get this party started. So let's talk about it. Our first slide here talks about the Provider Relief Fund. Everyone's all at Twitter about phase 3, as well we should be. The federal government has made a significant investment into the healthcare industry to ensure that we are able to serve the American public throughout the public health emergency. So far, they have poured $175 billion, with a B, into our PRF, we call the Provider Relief Fund. Those payments have been made to hospitals, acute care facilities, and medical providers across the country through phases 1 and 2. These payments allow us to cover lost revenue due to COVID and restrictions from the public health emergency. Think dividers, think new contactless payment systems, HVAC systems, clean air systems, those type of things. This is not through the PRF, this is not for reimbursement of testing or treating uninsured individuals. They have a very special program where you can submit that through HHS on their website. These disbursements do not have to be repaid as long as providers comply with the terms and conditions that HHS has set forward. So if you've already gotten phase 1, you know what I mean about the attestation. If you've not got phase 1 or 2, once you receive a payment, you have an opportunity to decline it. But Kim will talk about that a little bit later on in our slide deck. So for phase 3, what they've done is they've kind of opened up the box to allow different provider types to come in. Now we have our regular primary care, our specialties, acute care hospitals, but this time in phase 3, they're also saying assisted living facilities, home health care agencies, foster care, developmental disability services. And these aren't people who were included in phase 1 or in phase 2, but this distribution is intended to get money into the hands of people who did not have an opportunity in phase 1 and phase 2. So now that we know which type of providers can apply, we need to talk about what makes you eligible to receive a payment. There are 2 different veins here. At least one of the following criteria have to be met. You have to be a Medicaid or CHIP program or a bill of Medicaid MCO. For those of us here in Maryland, we're talking Maryland's Physicians Care, AmeriGroup, those type of things. You can be a dentist, but you do have to have had services between January 1 of 2018 and March 31st of 2020. Some people, for as far as behavioral health providers, may be a little bit, their window may have moved a little bit later, as behavioral health providers are now in hot demand across the country. So you must have been a provider as of March 31st and provided services as of that same date. Now, you have to meet, it is required that you meet all of the following. You have to have had some taxes, paid some taxes for fiscal years 2017, 2018, 2019. Quarterly tax returns are just fine. You have had to have done some patient care in 2020. You could not be a provider that has stopped providing patient care but won a portion of this provider relief fund. So you still have to be providing patient care. There are some providers that stopped for a little while and then began again. Those providers are eligible, but providers who stopped altogether and have no intention on reopening are not eligible for provider relief funds through this phase. So there are 6 steps to get it done. 3 steps in the prepayment process, 3 steps in the post-payment process. The very beginning, you need to determine if you're eligible, we showed you those slides, and validate your tax ID, we commonly refer to as your TIN. This is where some folks are having problems. If your business maybe changed its name and did not update its tax ID information, your exact name on your W-9 needs to match the name that on your tax ID application. So for example, the practice where I work is called A+ Medical, PC. We're commonly referred to as A+. When I filled in our application, I had to put A+ Medical PC because that is the legal name of the business. Unfortunately, HHS and HRSA are saying that they're having some problems with providers whose tax ID does not match their name. And those providers will not be eligible until they get over that hump. So please be very careful. If you haven't already applied, be very careful. Use your full legal name, not any abbreviations or anything like that. Once you get past that step, they'll send you an email that says your tax ID has been verified. Once you get that email, they say, click here and use the portal to apply for funding. This is where you're going to put your revenue information and your tax information. Once that's done, your dashboard will not change until your payment has been received. So they'll send a payment to you. It'll usually come from United Healthcare, Optum, for people who are Optum people. Once you receive that payment, you have 30 days to attest. So you have to go in and say, yes, I want to have this money, or no, I don't want to have this money. And if you get more than $10,000, you have to report on the use of your funds. HHS will send you a very detailed list of what they want from you. But if you receive less than $10,000, HHS will report the information for you on their website, kind of like what they did with phase 1 and PPP. It makes it much easier for them. It's much more cost effective than hiring a bunch of people to make sure that people are sending in reports. They simply report the name of the business and how much public funding you got through phase 1, 2, and 3, and that's simply it. So if you're someone who does not want your practice's information out there about how much public money they have, this is not the process for you, because they're definitely going to put it on the website. It's a data heavy website. I don't know many people who have went on the website to check out, who got what. I think we're all pretty much too busy for that kind of thing. But they are reporting it there, and it saves us from having to report it. The requirement for the report came from Congress, so it wasn't HHS's, great idea. Okay. All right, so now we have some important definitions. These are terms that you're going to see when you are filling in your application.
So your operating expenses from patient care are those that you incur when you're basically delivering care. It's going to be your salaries, benefits, your medical supplies, contracted and physicians, interest and depreciation, but it does not include investments or rental property. Okay, so those don't qualify as expenses under this. And then you're going to need to know your operating revenues from patient care. So your gross revenues, how much you billed out, your adjustments. Your adjustments are going to include your insurance adjustments, bad debt, and any discounts, like self-pay discounts or any of those that you might have given. And that's going to be your net revenue. So net revenue and your operating expenses are the two big numbers that you're going to need to know for the application.
Awesome. Thank you, Crystal. Kim, will you cover the fine print for us?
Yes, now to the fine print. We must remember to attest to the terms and conditions. Read it very carefully first. We have 90 days to attest or reject the funds. If we don't attest or reject, HHS assumes that we agree to the terms and conditions. Also, as Coley said, the names will be posted and amounts received on the website. And again, recipients greater than 10,000 received will be required to report using the use of the PR funds. So again, less than 10,000, you're good. More than 10,000, be ready to report those funds.
Absolutely. It's really a great idea that they came up with that portion of the website where they could do the reporting for us. I mean, can you actually imagine at this point with COVID and the common cold and the flu and the industry is just trying to get back on its feet, that now we have to send reports to HHS about, how much we spend on gloves and Cavicide. So it was a definite blessing that they helped us out with that. So way to go, HHS. All right. Hot information here. This is a hard deadline. Absolutely a hard deadline. The reason why this deadline is so important, November 6th at 11:59 p.m. Eastern Time, because there are going to be two different timelines for payment. There are people, again, remember we said they opened up the door to all different provider types. There are going to be people who did not get the 2% of their annual patient care revenue who are applying now. Think optometrists, foster care. Those people are on a much faster track to get that 2%. For those of us who've already gotten our 2%, whether it's phase 1 or phase 2, there's going to be add-on money based on how many people apply who are still in that pool and the money that we got from other sources. And if you actually can prove a significant amount of loss. So there are two different timelines to keep in your head, but the most important line to keep in your head is you need to have it done by November 6th. Don't wait until November 6th to try to verify your tax ID. Give yourself time. If you've already received your 2%, then you're thinking to yourself, someone said this on the listserv today, I don't even know if I should apply. Absolutely apply. This is a rare occasion. This public health emergency, I can't think of one type of medical provider that has not, broke the budget to ensure the safety of their staff and vendors, the providers and their patients. We're all spending much more money on ensuring the public health than we did this time last year. So even if you get $1,000, $1,500, whatever it is, it's that much more ahead of the game. But keep in mind, November 6th at 11:59 Eastern Standard Time, that is it. That is the hard deadline. All right, so now we have some frequently asked questions.
Yes, so these were kind of the top three that people have been asking. One, everyone's wondering, what is the formula? How do we know how much, money we're going to get in phase 3? And it's based on a percentage, and it's a percentage of change. Change in the operating revenue minus the operating expenses. So, when you report that out and then report again, it's like, what did you use to make, what do you make now? And it's going to be based on that percentage. And then that actual percentage, we don't know yet. They'll let us know later when they find out how many people apply for how much and what the funding is. The second question is, if you receive phase 3, does it only cover the first 2 quarters? And no, it doesn't. These expenses didn't have to occur at the beginning of the year. It could be used at any part during the year. And then finally, if you receive funds from the SBA, PPP, FEMA, Medicaid, retainer payments, are you still allowed to receive phase 3? And the answer is yes, as long as they were not reimbursed from another source.
Fantastic. So Crystal, do we have any questions in the chat box, questions or comments?
No questions yet. I just see a comment from Marcus saying, woohoo, go NAB. Special shout out to Coley.
That's the Rockville chapter. Hey, Rock.
Yep.
All right, so let's turn our cameras up. Yewende is in the chat box, and we've got Ariel also in the chat box. Hello, everyone. Good night. Hello. Good evening. Thank you for joining us. One of the questions that was asked is, when are we going to get the payments? When are the payments coming? And the best answer I can give you is soon. I wish I could give us a date certain of when the payments are going to come, but because again, they're on 2 different time tracks. The people who've never gotten their 2%, their 2% is going to come first. After that 2% is given out, you're looking at that pool of all of the new providers, right? Based on your revenue, based on your loss, and if you've gotten money before, they have a lot of moving parts there, but they're going to give you a share of what's left in the pool after that. I think it's pretty fair. At this point, it's free money. We can't turn our nose up. Looks like Rebecca has a question. Do you have that one?
Yeah, Rebecca's asking, can we confirm if she received phase 1 payments greater than 10,000? She doesn't have to do any reportings. Is that correct?
So yes, phase 1 and phase 2 were very different than phase 3. Phase 3, because they're allowing so many different provider types who, this may come off as a little mean, but, we are a very highly regulated industry, medical providers. There are some people who are kind of on the outskirts of regular medical providers, and the regulations generally are not as bountiful, for lack of a better word. They don't have to deal with as many regulations as we do. So, and if they did, I think a lot of them would pass on the money. It's significant. Can you imagine being someone who does home health and suddenly you have PRAC, HRSA, HHS, OIG, all of these new, letters, this alphabet soup in your head, and you have nowhere to turn. Thank God for places like PAHCOM, where you can get the information from people who've lived through this a little bit. So they're saying these phase 3 providers, you get less than 10,000, no worries, we'll report it for you. If you get more than 10,000, then they're going to send you a very comprehensive list of what they want and when they want it. So they'll still have time, but as far as we're concerned, we're good to go with this. Perfect. So the last question that I had for the phase 3 is, when are we going to get paid, that kind of thing. And what happens if I decide not to take the money? That is a really good question. You do not have to accept the funds. For whatever reason, if your practice decides, hey, it's not worth the headache, or you see some impending red flags for later audits, and that's reasonable because there is no free lunch, right? If you decide to turn down the money, you have to do it within that 90 days. And they are very hard and fast on that rule. Day 91, that money is yours, and all of the responsibility of accepting that money, the terms and conditions that HHS has put out, are absolutely yours. You're on a timeline. Please keep aware. If you decide not to do it, if your managing physician comes in and says, hey, we're good, we don't want to do this, then just return the money. They'll give you explicit instructions on how to do that. It's a checkbox just to return the money, and they give you instructions on how to do that. All right. So we have any other questions or comments about phase 3? Have you guys already applied for phase 3? Anybody?
We did not.
No.
And we're not going to.
Okay. Yeah. I did. I did. And it was a really interesting prospect that, I attended the HHS webinar. It's about an hour. They have it posted on their website. And I have to say they did a tremendous job, especially considering there are some providers who've never done anything like this before. They literally hold your hand through the whole process. So if you have any questions or you need more information, go to that website, watch that webinar. They literally show you, put your name in this box. It's very, very clear and concise. And I'm hopeful for the providers who actually need the funding, that they get everything they need to continue to be in business. It's so very sad to see practices closing their doors, especially during the pandemic. All right, so ladies, cameras down. We're going to move on. Julie Radcliffe asked, who's going to reimburse the 99072 billing? Well, you know what, Julie? Let's go on, and I'll show you on my slides what we've got for that. 99072, to bill or not to bill? That is the question. So for those of you who don't know, the AMA gave us this code 99072. This is for additional supplies, materials, and clinical staff time over and above those usually included in an office visit when performed during a PHE, public health emergency, as defined by law. Okay. This code is really, really new. So if you put it into a lot of the payment finder things you see on payer sites, sometimes it'll come back that this is not a valid code, this is not a billable code. It is really, really new. Caveats here, you can bill it, but you can only bill it once per in-person patient encounter per provider. So that provider can do 1,000 things, but you only get one bite at the 99072. Some people have billed it as low as $10. There are some enterprising people who build it as high as $50 or $100. I can tell you that my practice, we actually got paid from Cigna, believe it or not. I think it was like $30 for the 99072. So nothing from Medicaid, nothing from Medicare. But private payers are actually reimbursing. So this is good news for those of us who can recoup at least a little bit of the money that we've invested in protecting everybody during the PHE. Now, for those of us who do billing and coding, we know that 99070 is the code that you would typically use for materials and supplies used during an office visit, face-to-face, of course, during an office visit. Like an extra IV catheters, extra trays, drug injections, that kind of thing. The difference between the 99070 and 99072 is that the 72 is during the public health emergency, and it has to be face-to-face. So if you're doing telehealth, this is not your shot. But if you're doing in-person, face-to-face encounters during a public health emergency, and your clinical staff is asking questions, you're wearing Tyvek or extra gloves, whatever your practice is doing, you want to document that in the note, make sure you have the appropriate documentation, but you can bill the 99072. Kim, do you want to talk about the expense factors?
Sure. Sorry. So the expense factors that they're talking about is time over what is included in the primary service of clinical staff time to conduct a pre-visit phone call to screen the patient, provide instructions on social distancing during the visit, checking the patient's first symptoms upon arrival, applying and removing their PPE, perform all that additional cleaning of the exam rooms, the equipment, supplies, the pens, the clipboards, on and on and on. So the time that, your staff is spending just doing all of these things that we have to do now. 3 surgical masks, the additional cleaning supplies, the hand sanitizer, disinfecting wipes, sprays, all of those things that, we're using in abundance. So the code 99070 has been added to it to go to 99072 so that they know that it's for these additional supplies, materials, and preparation, meeting its criteria.
Absolutely. So this is such an important code for those of us who, I know our practice has been open, we've never closed. We've been open during the entire pandemic, and we have made such a significant investment in PPE and especially cleaning supplies. And when you take a look at that price point, this time last year, a box of gloves was like $5. Now you're looking at $25 a box. So that takes a significant amount of revenue out of play, where you can use that money traditionally to train your staff or, Christmas bonuses. Let's not even go for a Christmas bonus. All of those things where we would have traditionally been able to reinvest that money into our businesses, we are spending on things that we literally throw away because of the public health emergency. I am such the full 100 that they build. It is according to that particular payer what they're going to reimburse for this particular code. It is super new. So, some payers are just not going to give you anything. And a lot of states are upside down budget-wise from the shutdown with COVID. So you're not going to see payments from Medicaid, state Medicaid. You're probably not going to see anything from Medicare. But if we can get the private payers to give us a few dollars on it, it will help going into the new year. And aren't we all looking forward to the E&M code changes that are coming for us in 2021? The year that just keeps on giving, right? All right, so we have some frequently asked questions. Crystal, what do you got for us?
So the first one is, for what type of patient encounters or services should code 99072 be reported? So you can use this code on any in-person patient encounter in your office. Okay, this cannot be in a facility, this cannot be a televisit. So they need to be in person. For what, it doesn't necessarily have to be an office visit. It can be a procedure or anything else you do in your office. But it does have to do with, it needs to be in person in your office. No facilities. Facilities basically are going to bill for their own PPE that they use. So, and the next question,
fellow NAB members, it looks like some folks are having trouble hearing us.
Okay.
That's Miss Burton. Francis, can you hear us now?
There's several people.
No, just Miss Burton. So
no, scroll down. There's about 5 people.
I see a couple people that say they can't hear. Are you able to hear now? Can they send us a message?
Well, they can't hear. They can't hear us asking to send a message.
I guess not.
No, I'm sending a chat for those who can't hear.
Okay.
So click on the reconnect link so that you can hear us. Can you hear me clearly? Yep. So Sheila's back in. She had to reconnect. Something happened, but people are reconnecting. So that's great.
Very good.
All right, Crystal, go for it.
Go for it. Okay. So what documentation is required to report code 99072? Basically, you're going to have to document in your progress note or, wherever the supplies that you're using over and above what you normally would have used. So your extra masks, your extra gowns, your extra wipes, and everything else needs to be documented. A lot of the, we expect that a lot of the third-party payers are going to require the documentation. They're going to want to look at it. Like, why are you billing? What are you billing us for? Can you prove that you actually used this in your office? So
fantastic. So that's one big thing. This code you can bill if you are using extra time with your clinical staff to screen, if you're using more cleaner, more PPE. This is a code that you can use during the PHE, but only during the PHE. 99072, only during the PHE. After the public health emergency is over, the code will likely be retired and we'll be stuck. We'll be left with our regular code, which is the 99072. Okay, we got some clarity on that point. Ladies, let's get your cameras back up. Perfect. So we've got some questions. One hot button.
Questions, comments?
One hot button question is, can we bill both? Yes, you can technically bill both. I don't know if they'll pay for both. Mutually exclusive. During the PHE, though, I'd probably go with the 7.2 is just who I am. All right, so Ariel Hester has a question. Hey, Ariel. Interested in hearing the level of detail being documented in the office visit note, both regarding, one, additional time staff spends going over screenings, social distancing protocols, ECT, the appointment start time, and two, what is the detail of supply use being included in the notes? Well, I can tell you, Ariel, just from my office, what we're doing here, we call it the blurb. Although all of our notes are individualistic to the particular patient and the particular reason why they're here, during the public health emergency, we are using a blurb that says we are in the middle of a public health emergency due to this new respiratory virus, COVID-19. Our office is asking the following questions, and that's our pre-screening questions. We are using the following for protection, and recently downgraded from our Tyvek suits to a plastic cover, a blue plastic gown. And that's because here in Maryland, we've pretty much flattened the curve, pretty much. Not saying COVID's behind us, not that, but we're seeing less and less COVID deaths, and that's always a good thing. If you guys are interested, I'd be happy to post my blurb in the PAHCOM member library, but that blurb, Ariel, I'm using consistently across the notes. I don't think that you'll need any more than that. I think that a lot of payers, they're not paying a bunch of money for these codes. There are some people who are on the listserv said that they got $7. Someone else said they got like $15, $15.50. But I'd use the blurb because it would be just our luck that no one has a blurb that they can put on, and audits are going to come. Like, hey, you can't prove to me that you had someone asking these questions. You can't prove to me that you were using a special list in cleaner to clean your office. So it's worth putting in the note. And I will absolutely, girlfriend, show you the blurb. All right, do we have any other questions? We do. Francis Burton asks, to be clear, we can only use it once per provider. Yes, once per provider per inpatient appointment or in-person appointment. So a patient comes in for an appointment, regardless of what that appointment is for, they see a provider, you can bill it Even if that patient is there for 13 or 14 procedures, you only get one bite at that 99072. They come back next week for another appointment, you can still bill it because you're still using those services, but you can only bill it once per one-time inpatient appointment for that one provider. Okay? All right, great. Let's see if we had any other questions. Lots of reclick. Oh, and by the way, we will share the slides in the PAHCOM library, and I'm sure Karen will post the recording to the PAHCOM website. Julie Radcliffe had a question. Kim, maybe you can get this one. What about types of providers? Can a physical therapist bill for this?
Yes, you can, because you've had to do all of the same precautions, using all of the supplies. You know, if you can bill Medicare, then you can bill this code. You know, again, you just got to get that blurb in there.
Yeah, so Ariel is, you know, she's Team Coley at this point. She happily take the dollars. These expense amounts are getting crazy, and we are just now seeing the second surge. And you know, I know that for a fact that Ariel works in maternal and fetal health. You know, keeping those ladies safe probably cost a pretty penny. And I know for us, you know, just keeping my staff safe, I had to lobby our doctor for probably about 2 or 3 weeks for him to allow us to get out of the Tyvek spacesuits, you know, and it was really lobbying because he was not ready to risk the safety of his staff. And our patients feel very safe when they come in and see us being extra precautious. But, you know, those suits are expensive. It's not something that we could have foreseen. Thankfully, we're in a very population dense area, and our patients and our office have very good rapport. So they're very loyal, and so are we. And we've had an opportunity to kind of grow during the middle of this public health emergency. Believe it or not, we're actually opening up a second office. So this has been a year of wonderful tragedies. Or tragic, wonderful, however you want to put that. But this has been a crazy year, and I'm just very grateful that some insurance companies and that our federal government are investing in the healthcare industry. You know, let us take care of you by you taking care of us. We can do this together. And if anyone has any further questions about that 99072, ask. You know, ask, look it up. The AMA had, I think, 2 or 3 articles about it. You know, they can't force people to reimburse you for it. I'd bill it anyway. I'd throw it up against the wall like some spaghetti and see if it sticks. It's just who I am.
That's right.
All right. So I think we have completed all of our slides from our very short slide deck. It's my favorite slide, my absolute favorite slide. So on behalf of your National Advisory Board, I want you guys to know we do this for you. This is not a paid position. This is a volunteer gig. And we do it because we love the PAHCOM membership and we truly believe in sharing knowledge with one another. This is our first episode of PAHCOM Live. And like all things new, you know, there are a couple bumps in the road, but we're going to be okay, right? If you have an idea for a topic you want to talk about, if there's something that you want us to cover, we're here for you. This is a short format, 45 minutes max, where we just want to get together and talk and kind of figure out where we are. You guys can comment, not just Ariel. Way to go, Ariel. But not just Ariel, but if you have a comment or a question, you can always reach out to us at nab@pahcom.com. We are happy to help. Thank you so much for your time. Thank you. Thank you.
Thank you.
All right. Good night, everybody. Have a pleasant evening, and we'll see you next time.
Bye.
Good night.